Vitamin D is a steroid hormone and controls many processes in the body. Approximately 20% of the UK population have vitamin D deficiency and a further 60% have vitamin D insufficiency. Now what's interesting is that vitamin D is actually considered a hormone partially because it has receptors that it can bind to which regulate gene transcription. It's derived from cholesterol, which things like testosterone and estrogen are also derived from. Now some of the things that vitamin D is able to do in the human body are muscle anabolism, bone strength, regulating the immune system. For example, in cases of vitamin D deficiency, many pathologies are involved, and I'm going to talk about a few of these. So the first and one of the most interesting processes that vitamin D is involved in is potentiating muscle anabolism. A study by Agoncillo et al. Showed how vitamin D deficiency decreases grip strength, and this could be due to a number of reasons. Now this was a study conducted in 2023, and they found that the most noticeable differences were in the elderly population. This could mean that there's potential therapeutic benefits in certain musculoskeletal diseases, so therefore vitamin D may be of some use in elderly populations that are unwell and are experiencing muscle loss. Another study by Zeke et al. This was actually a review, so they reviewed many clinical trials. They found that vitamin D was able to regulate mitochondrial oxygen consumption, and therefore vitamin D deficiencies can cause disruptions to the mitochondria. Mitochondria are just the sort of powerhouse or the engine of the cell, and therefore vitamin D deficiencies may be able to cause muscle atrophy in this regard, because if the mitochondria are not working properly due to vitamin D not being in adequate supplies, this could cause muscles to not have as much energy in the form of ATP, and therefore they're not going to be able to grow and repair as efficiently. Another review by Lalaskin et al. Looked at how vitamin D can interact with satellite cells, which are just cells that interact with other cells in the body. They sort of communicate with them. They saw how vitamin D can interact with the myogenic components of these satellite cells, which means that vitamin D can possibly enhance muscle growth and regeneration. They also commented on a study on how vitamin D was able to increase follistatin, which is the inhibitor of myostatin. Myostatin causes you to not be able to grow as much muscle. It sets a limit on muscle growth essentially. However, Lalaskin et al. Did conclude that there's not enough studies in healthy adults who are resistance training, so we have to be careful about generalizing our findings here. So another component where vitamin D is able to enhance is bone strength. This is particularly important in elderly people, but also young people as well. Vitamin D deficiency can cause things like osteomalacia, which is brittle bones. A review by Anderson et al. Showed how vitamin D status is an important marker in the blood for hip fractures, osteoporosis, and bone mineral density. They also showed how mice who have no VDR vitamin D receptors show a osteomalacia phenotype. A randomized control trial by Burt et al. Compared 4,000 to 10,000 IUs of vitamin D every day for 3 years straight, which is pretty impressive. And they were able to conclude that the higher dose of 10,000 IUs per day resulted in lower bone mineral density, but not strength, when compared to 4,000 IUs per day. Now this is really quite interesting because there's many influencers online on YouTube, for example, that would recommend 10, 20, even 30,000 IUs of vitamin D every day. And it shows that higher doses don't necessarily mean better results. The study did conclude that more evidence is needed to see if higher doses are indeed harmful. And a randomized control trial by Martin et al. Showed how vitamin D was associated with higher femoral neck bone mineral density. Therefore, we could assume that having a vitamin D deficiency or even an insufficiency as an elderly person could possibly correlate to having a higher amount of femoral neck fracture, for example. And this generally happens upon impact. Now, these findings were found on older men, so it's not necessarily generalizable to women or younger people, for example. And they concluded to explain how these results may correlate with hip fractures and low vitamin D serum concentration, which is really quite interesting to think about, especially in the realms of general practice and family doctors. Now, going on to the immune system, I think this is particularly important because we've not long come out of a pandemic, so seeing how vitamin D can actually improve our immune system. A review by Kikuta et al. Showed how vitamin D receptors are on major immune cells, for example dendritic cells, macrophages, T cells and B cells. The review also showed how a deficiency in vitamin D may also lead to autoimmune diseases like type 1 diabetes mellitus. Of course, there are many components in these autoimmune diseases, so vitamin D deficiency on its own may not lead to type 1 diabetes. Next, we have a clinical trial by Mitsuyoshi et al. They gave 6 to 15-year-olds 1,200 IUs of vitamin D per day, and they did this for about 4 months, and they found that it decreased the amount of school children with influenza, so that's just a common cold, by about half. They also found how asthma attacks occurred in just 2 children receiving vitamin D, compared to 12 who were receiving placebo, so they were not getting an active drug. Now, having already mentioned COVID-19, I thought I'd put a study in that mentions this. So a study by Wright et al., in fact a meta-analysis, which is sort of the gold standard, they found that all-cause mortality was higher in low vitamin D groups when in COVID-19 participants. They also found that the severity of COVID-19 symptoms were elevated in the low vitamin D group. These 3 studies indicate how important vitamin D is for the body's immune system. Now onto pathologies or diseases. A meta-analysis by Altieri et al. Showed how vitamin D deficiency is associated with type 1 and 2 diabetes and also pancreatic tumours. They said that the study suggests potential therapeutic benefits of vitamin D supplementation. However, I did find that their funding was from Biotech Pharmacal, which sells vitamin D, and so taking this study on its own is a bit sketchy. Next, we have a review by Jean et al. Who showed that vitamin D supplementation in chronic kidney disease seems to improve mortality rates. However, this seems to be absent when patients are on dialysis, meaning that vitamin D may be less effective in people with end-stage kidney disease. I think it is actually important to note here that more recent meta-analyses have shown that there's actually no differences in mortality rates, so this is a bit up in the air, and so we have to be very careful when generalising these findings. So finally, we have a review by Dorr et al. Who showed that vitamin D deficiency is correlated to more severe stroke outcomes, and that cognitive ability and motor function are not as impacted in individuals who had vitamin D sufficiency compared to individuals who were deficient in vitamin D. However, this was only shown to be the case in ischemic strokes, which is where there's a blockage in the brain, versus hemorrhagic strokes. Hemorrhagic strokes are where there's a bleed in the brain. They tend to be a lot more deadly. I must stress the importance that these findings were mostly correlational. There's many factors when it comes to reducing ischemia and also improving post-stroke outcomes, especially in ischemic strokes. There's a whole field of research on this. So please do like, subscribe, and put in the comments any future videos you'd like to see.